everybody to our panel discussion, Making It Add Up, not making it up, by the way, counting on data and statistics during pandemics and other disasters. As a result of the pandemic, I would say that data is on everyone's minds and lips, and it's no longer the preserve of the statisticians and the policymakers. Here in Europe, and I count myself amongst one of them, we've all become addicted to data on vaccination rates, comparing our countries, how are they doing. Now, here in Europe and Switzerland, we're really fortunate to have access to vaccines, unlike a lot of the world, but still people are hesitant to take them. And even though the two vaccines here in Switzerland, Moderna and Pfizer, have off the Richter scale efficacy rates, 57% of the population is vaccinated, and that is one of the lowest rates in Europe. So what do we do when the data doesn't convince? That's going to be one of the questions that we scratch our heads on this panel and think, what are we going to do? But we would really like to hear your thoughts, your comments as well, because obviously making this data understandable during a pandemic, also, do people trust it? You know, policy makers, NGOs, statisticians, you know, what is your role and responsibility? And one other thing, just to say, I think you'll remember that Nicholas, on the first day in the opening ceremony, he said, UN what forum? Does anybody know about this? Has anybody heard about this? And the one way that you can amplify this forum is to tweet. And we've been giving you hashtag UN Data Forum and @TheRoadToBurn. So if you do want to get the message out beyond these four walls, please do use that. So, who's sitting with me? Well, Aiden Eyakuze is Executive Director of Twaweza. Make it happen in Swahili?
The easier one is, yes, we can.
Yes, we can. Good. A good Obama slogan there. So it's an NGO that's all about amplifying citizens' voices and holding governments account in Tanzania, Uganda, and Kenya.
That's right, that's right.
Good. Oliver Morgan, who's the Director of the Health Emergency Information and Risk Assessment Department at WHO's Health Emergencies Programme. So that's a man who's rather busy at the moment, I would say. So we're delighted that he could come from Geneva. We've got somebody who's come much further than from Geneva. Aiden also, by the way, has come a long way. Manja Kagbo is team lead of the Mayor's Delivery Unit, Sierra Leone Freetown. And then we have, joining us, I hope, from Jamaica, is Carol Coy, the Director General of the Statistical Institute, joining us remotely. But do you know what time it is in Jamaica at the moment? 4 o'clock in the morning. So I think she's excused if she hasn't managed to set her alarm. We have Neil, too, Neil Myrick, who's joining us from Seattle. That's also not great. That's 1 o'clock in the morning. Neil is Global Head of Tableau Foundation, which on its website has this great strapline, "Let's build a better world with data." And many of you will know that Tableau is a data visualization platform. So you can see we've got some great speakers. Now, just to set the scene so you understand a little bit their reality in terms of data, I'm going to ask them, and we're going to think COVID, what was their biggest challenge during the COVID pandemic, and how did you respond? And I'm sure, again, there's a long list, but I'm going to ask them to be quite concise. Manja, take us to the world of Freetown in Sierra Leone. So what was your big challenge in terms of data, and how did you respond?
Okay, just to give a bit of context of Freetown, Sierra Leone, we're the capital city, 1.2 million population, 35% of our population live in informal settlements, so those are the most vulnerable. And even when you say those are the most vulnerable, data also shows that even within that, there are those who are more vulnerable than others. So our challenge was, how do we get to these 435,000 residents in informal settlements who have very little access to information, live in very poor conditions, and have and live on day-to-day subsistence. So in terms of how they earn their money, if they don't work today, they don't earn any money today, and that means they can't feed their families. So that's the context with which we approach COVID in terms of Freetown. We also saw what was happening in China at the onset, and so we made a plan. It was really important that we planned because we knew it was going to come to Freetown at some point. It came to us on 30th March 2020, and we were ready. We had been able to get the resources, and we had a plan. Our plan was go into these communities, talk to them about COVID, what are some of the preventative measures, and what do they think? How do they think they should be able to respond? One of the things that we found out immediately, social distancing. In informal settlements where you have 15 people in a home, people live in very, very small, cramped conditions, you really can't social distance. So we asked them, what does social distancing mean to you? And one of the biggest responses was, it means keep your hands to yourself. So that was the message we started using. So for us, in terms of data, in terms of information, it was really important that we were able to co-design and go in and meet residents, speak to them, tell them about what the situation was around the world and how within their environment they could adapt.
Thank you. Aidan, take us to whichever country you'd like to take us in East Africa and tell us what your data challenge was and how you responded.
Thank you very much, Claire. It's a pleasure to be here. So, Twaweza works in 3 African countries, Tanzania, Uganda, and Kenya. And I think the data challenge there, what we thought we could contribute as a civil society organization, was to inform government of how citizens were really experiencing the COVID pandemic and the inconvenience that it was bound to bring, and it has brought to their lives. So, you know, the governments were all trying to react to stop the spread of the virus, to reduce hospitalization, all of those kinds of things. And as with Manja and Sierra Leone, some tried very hard the social distancing. You know, I think Kenya tried harder, for example, than Tanzania, and sometimes with excessive force by the police to stop people from moving around, and a few people lost their lives. Other countries, Tanzania didn't go wholeheartedly into the social distancing, mobility reduction, etc. But still, there was a sense of panic. How widespread is this? Do we have the testing capacities? People are being hospitalized, people are dying, funerals are being held at night, you know. So there's an element in a sense in Tanzania of an attempt to sort of downplay or suppress the data, you know, the horrors of the pandemic. And we thought that may not help the situation very much. So what we tried to do was poll citizens using mobile phones. We've got panels in each of these countries, and we'd call them up and say, how are you really experiencing COVID? What are you trying to do to stop the spread? How are you protecting yourselves? What do you understand about this? So that we could convey this information to government and help, especially in their risk communication strategies. How are they best to communicate to citizens in order for them to comply with things which were a bit unnatural? You know, social distancing, mask wearing, all of these things were very new. And hand washing in a context where there's not a lot of water, clean water and soap around, you know. So there was an attempt to do that. We tried to make people understand how ordinary citizens were experiencing COVID-19. And there's a whole bunch of other stories, maybe we can get to it a little bit later, how we were effective in that, how governments became nervous about the information and knowledge and data around COVID was spreading around. One government, my own in Tanzania, decided they were going to fight the fear. It was more important to fight the fear almost than fighting the virus, right? And that has had its own implications. We can get into it a little bit later on.
Yes, indeed. Governments with their own vested interests and interpretation of data. Indeed. Carol, thank you so much for joining us. And somebody tells me it's 4 o'clock in the morning in Jamaica. Yeah, that's almost a round of applause in itself, I think, that you're here. Yeah, though you can hear that. You know, we've all had breakfast, So, you know. Carol, what I'm just asking is, from a data perspective, in the National Statistic Office, what was your biggest challenge during the COVID pandemic, and how did you respond?
Okay, our biggest challenge is the ability to provide the data timely and the data that was needed. So during the pandemic was when governments and policymakers and the private sector needed to have information to see what was happening because of the COVID, not just health, but economic, social. And at that point, for us, it was new, the issue of we collect most of our data face to face. And so, with this breakdown in that ability to be able to do that, the problem we faced was how do we provide this data that was critical, given that we were not able to do our usual mode of data collection. So, that we found was the biggest difficulty, and they needed this data in a timely manner. And we were not able to provide it because the country basically shut down. So we shut down some of our surveys.
Neil, what was you're in Seattle, where all things are possible. You perhaps don't have the same challenges as Sierra Leone or Tanzania or Jamaica, but from a data perspective, in your business, what was the biggest challenge and how did you respond?
Thank you. We spent a lot of our time actually helping many other organizations respond to their challenges. So the challenges Carol mentioned were very common, getting access to timely data, and being able to then clean and structure the data in a way that could be useful. And that was the biggest challenge we saw was lots of data were being produced in varying levels of quantity and quality. So there was a big effort in sort of finding the right data sources, validating them, structuring them properly, and being able to then build visualizations that would allow people to see and understand what was happening in their community. One of the other problems that we saw that was quite common is the lack of disaggregated data. So data broken down by race or by gender or by other characteristics that were important in the various countries. And in the American context, of course, we were in the middle of a racial issues, and the way that the pandemic was affecting various different races and ethnicities who had access to resources and vaccines was a big challenge. And so we put a lot of effort into really mapping those challenges to understand who were the underrepresented groups, what resources did they need, and how could the resources best be delivered to them.
Yeah, interesting. Oliver, you've been hearing all of this, so if you'd like to make any reflections on what you've heard, please do. I know the WHO, many challenges, but with data, what do you think was the biggest and how did you respond?
Well, for us, I think there were three broad categories of challenges. One was around data volume. The other was about speed of processing and reporting, and the other was really the data diversity that we had to manage. WHO is a specialized agency of the United Nations, and there are 194 countries who are members of WHO, but actually we encompass every single community on the planet. And so our job isn't done until we've got real global coverage. And that presents some obvious challenges in terms of collecting information from every single country every single day on a 24-hour cycle. I think there are a few aspects to that which maybe were not so obvious as you went into it. I think one of them was that for many countries, and we receive a lot of official statistics, for many countries, every single case is in some sense some statement about nationhood. And there are many disputed territories and many communities that live in disputed territories. And how do we as the World Health Organization report what's happening in those communities is very challenging. and that generates quite a lot of diplomatic consequence. So that was an interesting challenge that we had to face. The other challenge, of course, was kind of a particular characteristic of the COVID-19 pandemic, in which people were interested in every single case. So in many outbreaks, very large outbreaks, depending on how they're controlled and the nature of those outbreaks, we might only take a sample of those cases and report them, for example, cholera or influenza. This is something that sometimes happens in certain diseases. But for COVID-19, we're interested in every single case and contacts and in every part of the world. So the volume of information was really quite extraordinary in that sense. The speed issue, again, seems like a kind of an obvious one, but it's particularly challenging as we're working across every time zone, and we do have this 24-hour delivery of information from countries, from member states, and it's very easy to get something wrong, especially dealing with so many different reporting entities. And again, that generates a lot of inquiry and back and forth communication between countries who say, well, you've got our numbers wrong, or they're out of date, and so on and so forth. So the speed issue is a particular challenge as well. And data diversity, which I think will come on to a little bit more in this panel as well, I hope. But that was an interesting and very enriching experience. And I've heard some discussions of these types of issues already in some of the some of the sessions this morning. But in essence, we were often faced, and we continue to be faced with the type of question of, well, what is the right answer? I hear, from this source, this information being reported, and I hear from another source a different type of information, and what is the right answer? And as the World Health Organization, there's a reasonable expectation for us to understand and be able to provide some guidance about what is actually happening. And so that data diversity, while challenging, I think was enormously enriching, and maybe we'll have a chance to make some comments about that in the future.
I mean, the geopolitical ones, how on earth do you overcome those with, these Nagorno-Karabakh, who does that belong to, or I don't know, the occupied territories, or I could name a number of Kashmir, I don't know, all of these. How on earth do you deal with that?
Well, I think these types of issues are probably familiar to many people who are attending this conference, because even at the sub-national level in local administrative areas, there can be challenges about how to report information that's happening in communities and across administrative areas. I think it was particularly, we deal with these issues like many institutions that work with official statistics. We are regularly engaged in this type of challenge.
Are the stakes higher, though, you wonder?
I think there are many subtleties that come out, and I think the problem is that they all come out at the same time. So there are dozens and dozens of either disputed territories or different ways that different countries report their information, which have particular specificities. So it is quite challenging for us.
And this was like Tanzania, because if I vaguely remember at the time, there was no COVID in Tanzania. Was that? Was that?
Well, that's the point I was making a bit earlier. I think the strategic decision that was made by the previous administration was to fight the fear more than the virus itself. Sierra Leone, Tanzania, how do you shut down an entire economy which is largely informal, who are living cheek to jowl? So the mobility restrictions couldn't, in fairness, be applied and complied with, right? Kenya tried to do it, and they tried really, really hard. But it also led to maybe excessive use of force by their security services, and a few people lost their lives trying to enforce the mobility. Uganda also went really hard on mobility restrictions. And I was reading a paper just on my way here about the devastating economic impact that has had. They complied in Uganda, but I think the livelihood loss was enormous on ordinary people. Our own surveys showed that it was the informal, urban sector, which suffered the most as a result of mobility restrictions in Kenya and in Uganda. We haven't done similar studies in Tanzania. We're trying to see if there's actually any differential response. Look at South Africa and their lockdown as a result of COVID, and the incredible hardship it has resulted for people who are living on the margins, on the edge, in the informal sector in those urban centers.
So I was picking up on something that Manja said about, well, we had a plan. And I'm just wondering to ask our speakers, I mean, hindsight is a wonderful thing. Manja, with the benefit of hindsight, is there anything that you would have done differently?
Definitely. So we had a plan, we had the resources, but we didn't get the data ahead of time. So when COVID now was in Sierra Leone is when we now went into collecting data, going into communities, asking them, what's your fear now that it's here? But we already knew it was here in the world, just not in Sierra Leone. So I think a lot of us waited until it arrived on our doorsteps before we began to really look at the critical components in terms of how we would plan. We use ODK apps, so technology was really important for us. We went into communities. What do you think about COVID? How do you think you get COVID? How do you think you can prevent COVID? Do you even think COVID exists? These are the questions that we were asking in our communities, and we were able to use that information now to really get a community engagement plan that could speak to communities. Speaking about mobility restrictions, we went into the market and we understood that that wasn't an option. So what did we do? We then said, let's go into the markets and let's create a different flow. So if everyone in this area is selling peanuts, we'll put them in one area. If everyone is selling palm oil, we'll put them in one area. That way, once you come into the market as a customer, the flow is easier. You're not going all over the place looking for things. So we really tried to adapt, but ensuring that we knew that these women, especially women, couldn't afford to be restricted. So we wanted to use, we used the data, how many people in the market sell these products, how many sell that product, and then use them now to segment them into the market, and that worked really well.
Carol, benefit of hindsight at the National Statistics Office, what would you have done differently?
I think, as the previous speaker said, I think we underestimated the impact of COVID. So we thought it's something that we would, in 6 months, would have gone. And so I don't think we prepared as a statistical agency for something such as this, the ability of the idea of not being able to collect data from persons on a face-to-face basis. We never faced that before. And so it's the preparation for disasters, which I think is the issue. Now we live in we are a small island developing states, and disasters are something that we expect, and I think is something we discuss all the while. How do you respond in a disaster? But we never ever put anything in place. And so what COVID did was to force us in a short period that you had to make adjustments quickly and so that you were able to provide some type of information to government.
And you set up a committee, didn't you, of different stakeholders?
Yes,
you realized that was important.
Yes, what we did was a inter-sector committee of all public sector agencies who would be responsible for data, academia, private sector, civil society. That committee was set up in short order. It was chaired by the National Statistics Office and the Ministry of Health. And the aim of this committee was to bring persons together. On our part, we were the coordinators to bring persons together so we can see wherever there was data, if there's administrative data, if civil society had some sort of information, how do we come together? And the issue also was to better use of resources, because in the middle of the pandemic, what we found was government had to reorganize its resources. So for this, the National Statistics Office, your budget was cut significantly. So rather than all agencies duplicating, wasting resources, We would, this committee would guide where the research was, where the data would be coming from. And it was much more than just data, because it looked, first of all, it looked at clinical data, it looked at socioeconomic data. So it was a wide ranging committee. And communication was a critical part of it. How do we communicate this type of information? So that was what, as an agency, we had to do quickly.
Yeah, and we'll look at communication in a moment. Aidan, anything that you would have done differently? I mean, you got these mobile phone surveys out. You were telling the government, yes, COVID does exist. You were doing your bit, your advocacy. Was there enough preparation, enough planning?
Well, we learned, I think, from Tanzania how to communicate better in Kenya and Uganda when we surveyed the numbers. There is, let me be frank, sometimes I think in civil society organizations we can do a bit of scaremongering. You know, this situation is really bad, and so therefore act on it. You know, and governments don't always like the messaging done that kind of way. So I think we adjusted our narrative in the other countries, and we found tremendous cooperation from the government of Uganda and the government of Kenya. They wanted to understand in a sort of 360 way how their citizens were actually experiencing COVID. So one thing that we did was we'd share our findings of the data. They were pretty high frequency. I think every 6 months we've been asking Kenyans and Ugandans, how are you experiencing COVID? Are you trusting government? What information sources? What are you confused about? And this has helped the government do a better job of risk communication as well. Plus, we made a video. We can talk about the video later.
Ah, well, you should have had the video so that we could have shown it. So
at the end, maybe I can make you all dance.
Yeah, yeah. Well, absolutely.
Video.
That was a miscommunication there. We want the video. Neil, because I'm just being very even-handed here. Benefit of hindsight. What would you have done differently? Did you have your crisis communications plan ready?
Yes, I think what we saw across the spectrum of work we did, three things come to mind. One is data were shared oftentimes at a very high aggregate level. And I think what we saw was a missed opportunity to make the data more personable and more relatable to individuals. I really admire the work that Aidan and Manja talked about. We think that getting community-based data is very important to really telling the story about what's really happening. And it's also very important for helping break some of the myths that spread. And then we also believe that one of the issues is that the decisions that policymakers were making had to be made in a hurry based on facts on hand. I remember seeing some data from a very reputable survey that found that mask mandates didn't work in terms of in terms of making people wear masks in certain locations. And instead of sort of having those data at hand from a policy perspective and being able to decide sort of how to manage the mask mandate issue, everybody just did mask mandates because they felt like that was the best thing to do. So I think having more data available like that measures the public responses to some of the rules would have potentially helped. And then the last thing I'll say real quick is, we responded to the Ebola crisis in 2015. We've responded to multiple natural disasters. We've worked on malaria campaigns. And what was interesting is how much of what the global community has done around the world to fight infectious disease felt like it was new again. And especially in America, contact tracing was something that was done around the Ebola virus in 2015, yet in America, it sounded like it was a brand new thing that nobody had ever heard of before. And so I think lessons learned, the question is brilliant because I think we have all these lessons learned that we don't necessarily, as Carol said, put into place in preparation for the next thing that's going to happen to us.
Yeah, and I'm sort of interested in this mask mandate and exactly, where is the data, where is the evidence? Because I'm just looking around me in the hall. Some people are wearing masks, Neil, some people are not. It's an option. but the rules are just like crazy, right? So we actually don't have to wear them when we're seated, but when we go to the forum, on that way, on the road to the forum where we get our drinks, we have to wear them, right? So where's the data for that? I mean, where does that, so we're totally confused. I mean, I went to Austria last week, and I was getting on a plane, and I was told I had to wear one of these, which is a medical mask, yeah? And in Switzerland, we use one of these, which is not a medical mask. And suddenly, on the tube and on the transport, we had to wear this one. Well, why? You know, where's the data? Where's the evidence? I don't know whether you know, Oliver, but why? You know, where's the evidence that that one in Austria is better than that one? Yeah, and you know, it just seems. You know, I believe the data because I do quite a lot of work with regulators and pharmaceutical companies and so forth. But you know, if you don't believe the data and you're mistrustful, this just adds to the mistrust, it seems to me. Where is the data, Oliver, on masks?
I mean, there's quite a lot of data that's before the pandemic and then subsequent to the pandemic. And I think actually this is an area where in some ways there was a bit of information overload, which led to quite a lot of confusion. And I think this is quite emblematic of this pandemic, but it's not unique to this. I mean, pandemic, I think this happens a lot, and communities can, you know, often are confused by the messages that arrive to them. I think one of the big challenges we had, particularly here, was trying to work through a lot of scientific information very quickly. And one of the, let's say, the responses to some large outbreaks of the last decade was for many, certainly in the scientific community, for medical journals to provide copies of manuscripts that were submitted to them in advance of them being peer-reviewed. What this actually did was it pushed the issue of trying to assess whether a manuscript, a scientific manuscript, was well done and valid or not. It pushed it kind of upstream. So we had to have a whole lot of manuscripts and information from scientists which hadn't been reviewed by anybody. In the interest of speed, it came to us quickly.
Versus accuracy.
But then we had all sorts of information which had not been reviewed by anybody else. So in many ways, that created an additional burden, so made it particularly difficult. And so I think that's another example where we were a little bit overloaded as a global community, public health community, and a number of different conclusions came out. And I think that the idea that there's a single, or necessarily a single answer and a single conclusion, maybe that's, I mean, that obviously didn't happen. It still isn't happening, and countries are making their own decisions. And even when they're in a kind of coordinated situation like the European Union, which has a coordination mechanism, member states are still making their own decisions, and communities are also making their own decisions. And that is not a unique feature to this pandemic. This happens in all outbreaks and all emergencies, and I think this is one of the kind of the complexities that we actually just need to embrace rather than see that as particularly a wrong thing.
Maybe, Claire, just to add a thing to Oliver's point, the pandemic was really dynamic. We weren't quite sure how it was playing out. We thought we'd have one wave and then, phew, summer we'd all go back to school and Christmas would be like it was the year before. Well, no. So there was an element of precautionary principle as well. That's why, the Austrians tell you to wear the medical mask and others saying, well, So the precautionary principle in play there. And the other thing that I really don't envy the World Health Organization, my heart goes out to you, was that I think humanity wanted definite answers. Masks on or masks off. Vaccines work 100% of the time or they don't work at all. So the world wanted binary solutions, and the pandemic is anything but binary. So we have to find a way to really surf the pandemic wave, and data is a way to help us understand where is the surf bigger, where is it smaller, how do I position my country, myself, my family, in order to address that. And I think on here, official data really, if amplified by non-official, citizen-generated, civil society-collected data, helps you serve that wave a bit better.
And But it's sort of, interesting, isn't it, that there is, all of this, confusion about data. And, if you trust the authorities, you'll think, oh, well, they'll get it right eventually. But what happens when you don't trust your authority, or you are from a community which feels, marginalized and so forth, and then even if there is data, I mean, let's bring it back to Switzerland. Best vaccines, 94%, 95% efficacy rates. Aren't we lucky? But only 57% of the people are vaccinated. And how do you convince them? I mean, is data enough? Because people who are not data geeks, and if they're mistrustful of their governments, what do? Anybody?
I think you have the data scientists, but then you also have the policymakers and the people. And that's why it's really important to be able to co-create together. There are lots of local level politics and dynamics at play. In communities, there are different influencers. So the person that influenced me doesn't necessarily influence you. So it's not a one-size-fits approach when it comes to data. And I think a lot of times that's what we've been doing, especially with COVID. It's important to really understand the individuals when you're looking into data so that you're really able to serve their needs. Because at the end of the day, data is about serving people. When you're able to do that, then you'll be able to get better success and able to use the data for its intended purposes. In Freetown, you're in the informal settlement. One size fits all, but within the informal settlement, you have people with a disability, you have women, you have children, and they all have different needs. So the data has to take that into consideration, and the person going for the data, collecting the data, has to be someone that they trust. And usually it's important that it's someone from the community, someone that understands the nuances of that community, because it's a lot less easier for them to manipulate the information. So for us, it's really making sure that the policymakers, the data sciences, and communities are working together and wanting and understanding that they want the same things.
Yeah.
I mean, I think the concept. That there's a kind of an official set of information which is somehow the truth, and there's other information which is somehow maybe aligned or not aligned. I think is a little bit antiquated, to be honest. I think we're now in a world in which information flows in a much more different way. And as individuals, I mean, even though I work with official statistics, I still live in the community, and the information that I receive comes from many different places: my friends, my family, my neighbors, and so on and so forth. And so, we, certainly, if we're working in an official statistics institution, I think we really do need to embrace the importance of multiple different information sources and data sources arriving at individuals, and not dismiss them as necessarily, putting them into simple, dichotomies of being right or being wrong, but people share and amplify messages for certain reasons. And it's really important to understand that. And I think while it's not necessarily new, and the pandemic is, again, maybe is just a very clear illustration of this, I think what is changing with the way that we share information in the digital space is it's increasingly it's increasingly easy to just consume the information that you want to consume and not have alternative viewpoints coming to you. And that's, there are algorithms that push information to you depending on what information platforms that you're using, and it's quite easy just to hear the messages that you want. And that works both in terms of messages which might be considered non-mainstream, but also for mainstream, like the types of information feeds that come into my social media platforms, is probably reinforcing, my biases as well. So trying to get out of that bubble is very important, especially when we're trying to communicate what's happening about an outbreak or a pandemic.
Yeah.
Maybe just the video story. In Uganda, when we found out that many people were actually not wearing masks, we thought, how do we help government communicate this? And we realized that there is a very popular comedy troupe. So we thought, why don't we make a video, literally, with this comedy troupe, whom other people have a trust of the satire that they make about their lives and the politics in Uganda. And so we did. We created a video called Yambala Mask, It's in 6 Ugandan languages, and put it out there for people to now understand from a non-scientific, non-scary, a little bit funny, satirical angle why it is important that you wear your mask. And we saw a bit of an uptick in mask wearing in Uganda in around about July, August, September of last year. We'll see if it's maintained.
Well, I think you should put it on the UN Data Forum website and amplify it, and get as many clicks as possible on that. So yes, let's look at communications. Neil, communications is your business. You know, when people don't understand the data or they don't trust the data, I mean, how can you make it accessible to them? How can you visualize it?
I think in two ways. I think both Aidan and Manja made really good points. You know, the power in data is how you can use it to tell stories. Mm-hmm. And I think the stories that you tell, because as Oliver said, the way that social media works today and the way that information flows, everybody is getting, not everybody, but everybody's getting kind of a personal story and a personal feed. And I think a lot more thought has to go into, if you are going to use data, what's the story the data want to tell or need to tell, and then how do you tell that story in 100 different ways or 1,000 different ways for all the different audiences, versus having, here's a heat map and everybody should understand and react to the heat map in the same way. That doesn't work anymore. So we have to really think of data as just being a tool, and the storytelling that we do with the data is actually being the really powerful force that hopefully can change minds. And then lastly, I'll say, just Manja and Aidan both talked about this, the citizen generated data is very important. And then the messenger is also important. And we learned that back during the Ebola crisis in terms of hand washing and burial rituals and so on. And we learned it again during, the pandemic, where the person who is delivering the message is as important as the message itself.
Yeah, as Manja was saying. And there is a sort of sense also, I think, that, if you don't see it, you don't necessarily believe it. So, here in Switzerland, there were no pictures on the television of what was happening in the ICUs. And it was like, and so in Geneva, you were like, well, are the Swiss hospitals just so amazing that they'd managed to cope with this? Because we could believe that because, we're in Switzerland. So what's happening? And then, all of my manicurist, still today, she doesn't believe there's COVID because she hasn't seen it on television. And, well, where are those pictures? And Arthur, the other moderator, told me something really interesting. He said, but Swiss journalists were not allowed to film in the hospitals. And I'm like, wow, because in the UK, we saw the pictures. I mean, perhaps in your countries, you saw the pictures. We knew that there was a face of COVID and that it was happening, yeah? And interestingly, a friend said to me yesterday, but Switzerland's biggest hospital, the HUG, they've decided to put on their website all of this video that they did collect of people in hospital. And I'm like, great, but isn't that 18 months too late? And it's sort of buried on their website. Who's going to go onto their website to look for this video? Amplify it, get the message out there that this is real. So, we've been talking about social media and the bubbles, but I'm just wondering, because of course I came from the traditional media, and I remember, Carol, you said to me that you use the media quite a lot in Jamaica. So perhaps you can tell us about that, the role you see for the media, whether it's the traditional media or social media.
Okay, thanks, Claire. Just to reinforce what the other speakers are saying, the COVID pandemic allowed us to realize, as national statistics officers, we are not a monopoly. People get data from wherever they want, and it's something that we have to learn, and we have to, how do we compete in this world? Well, for us, we use the traditional media to get data out, because we found we were not getting data out. But what we have found is social media has become, because that's where, especially the younger generation, they really don't watch TV, or they're going to watch Netflix. They're not going to watch the local news. So it's the social media that you have to use, and you have to use infographics, or you have to put animation in a way that allows persons. You have to maybe pick out what the main story is rather than a whole table, which we are used to just providing this table and people will know what it says. We now have to look at how do we, as an organization, we have realized we need communication specialists. Previously, they were not important in the organization, but now they are important to take that information you have and to put it in the different various ways for social media to get it out there. Now we are hiring social media specialists to do some of our, our dissemination. And so that is the way I think we will have to move going on, that we will have to use it. For example, we have the census coming up. One of the difficulties to get persons to participate in a census. How do you get out there to tell persons the importance of it? The traditional media is not going to work. So we have to find alternate ways, and social media. Look at what happened yesterday. There was a shutdown in social media. I think the younger persons thought the world had come to an end. But so there was no Facebook, no Twitter, no Instagram. So yes, Twitter was on. Sorry, no WhatsApp. So this is how I think as NSOs, the COVID has forced us. We have been saying it, as I said, for some time, but COVID forced us to move from our traditional ways of doing things and to be able to, as I said, compete in this world where information is going fast and furious.
Yeah. Manja, so of course that relies on connectivity and so forth. I mean, what were you doing to communicate?
So the national government had a platform on Facebook. Every day would get information about COVID, the number of cases, number of deaths, very Excel spreadsheet-like looking document. And then we had WhatsApp. WhatsApp is huge in Sierra Leone, in Freetown in particular, and that's where all the fake news happened. So the fake news happens, the national government, which is responsible for providing the information on a daily basis, is slow to react. And so we then needed to get into the structure. So there are structures in communities. Again, we really rely on communities to pass on information. And one of the great things that we've done is that we've embedded some of these community structures as part of the way the council works and link them to national agencies so that we are constantly interfacing with each other, whether there's a disaster or not. So in terms of information from the council, from the city, these community structures have it. They're called community disaster management committees. And so we relied on them heavily to pass on information. And their political structures were the ward development committees. Again, these are the people that we use to pass on information because we couldn't allow the people, our residents, to rely on what was coming on WhatsApp. WhatsApp was frequent, it was always misinformation, and it really looked at, it targeted news on death. It targeted news on areas that were contaminated. A lot of it weren't true, and you had people reacting in negative ways. You had people going into communities wanting to attack, saying you've brought the virus into our community. So it was really important that we were able to get people in the communities, and also two-way communication. We know that social media, the information is there, but you can't ask questions. You can't feedback. And so when we have these community structures in these communities, then people are able to say, well, this is what they've said, and we're able to say, well, that's not true. But obviously making sure that that's done within the COVID restrictions as well. So making sure that we had our masks on and making sure that we were going into these communities with masks so that if we were going to engage someone, we'll say, before I speak to you, you need to put on a mask. I have one, here it is. But it was really important that we were able to speak to communities directly as things were unfolding and not allow the rumors on social media to take root.
Thank you. So I'm going to go to the audience for some questions, and we're going to see whether there's some virtual questions. But I was also, there's been a free-flowing sort of discussion, because if you look at the information for this particular panel, it's pretty free-flowing, and everybody's got their own interpretation of actually what this title means. So, we've had a go at interpreting it, but I know that, because I was listening, honestly, I was listening, Oliver, you said you wanted to talk about something else, and I know you wanted to talk about something else, so I'm just throwing it open to my speakers. If there's any points that you've not made before I go to the audience, now is your moment.
So let me make a quick point. Data processed leads to information, and when I was studying in my grad school, I read a quote that information is the reduction of uncertainty. We have just looked at some numbers from Tanzania, and there's a lot of uncertainty about, fake news and misinformation. There's a large number of Tanzanians who are unsure about lots of things. So maybe the thing to do is to make that uncertainty your friend and ally, because uncertain people are persuadable. You can convince them of the right thing. But it's the ones who are dangerous are the ones who just know precisely that this is right or not right. I think Mark Twain said
There was a
something
Mark
like that.
Twain quote
Yes,
there,
Mark
isn't
Twain
there?
said
Yeah.
that. Those ones are, you leave them behind. So make uncertainty your friend. So the world is uncertain about a lot of things. Let us be honest and open about, we don't quite know yet, but, you might try this, you might try that, and it needs to speak to their context, to their understanding. Any condescension, any paternalism, it just makes them certain that you don't have their interests at heart, and so they'll ignore you.
So I'm getting quite a lot of body language. You have to read the body language when you're talking to people remotely. And Neil is nodding his head there. Neil, if you'd like to respond to what Aidan has just said, and if there's something that you think is really germane to this discussion, please bring it in now.
Well, I very much agree with what Aidan says, and was nodding vigorously, as you noticed. The only thing I will add on, in addition to what Aidan said, is the other thing I think we have to focus on is simplicity. The social media messages that get consumed are very simple messages. I think, those of us who do this work for a living, we see the complexities, we understand all the nuances, and we try to communicate, I think, too much of that. And we need to really figure out what is the easiest, simplest, Twitter-friendly message that we can send to really keep up just with the flow of information and with how people want to consume it.
Well, there we are. That's a challenge to our audience, to do a nice tweet about what's been said and make it simple. I'm just thinking, and I think I'm misquoting, because there's an Einstein leitmotif going through this conference that you may know, because Bern was where he lived for a few years and did his theory of relativity and some of the... and there was some quote there about, we have to make it simpler, not simple. Something on those lines, yeah? You were also, Oliver, nodding vigorously.
I mean, the point that I mentioned earlier, we actually did cover, which was about the importance of embracing a diversity of information and not being dogmatic that it has to be one type or the other. A point that we haven't touched on here, but I think it's critically important that we consider in the bigger picture and longer term, is around data literacy and information literacy, and how we use information as individuals and communities, but also through government as well, to make decisions. And it's very complex. It's something that I think we need to work on collectively going forwards. But we can produce clearer messages, simpler messages. But we also need to think about how information is critically consumed and processed, and I think that's an empowerment issue for all of us and our governments and communities. So we do need to think that through a bit more.
Yeah, Manja, you were doing some nodding there too.
Yes, definitely. I think that the best way to ensure that policymakers use data collected and produced and communicate it with citizens so that we're able to build citizen literacy is again through the co-design of a development agenda. When you're able to co-design, it really binds the government-citizen interface and ensures that one, we understand the problem, two, that we generate and test new ideas, and three, that we're able to deliver interventions.
Yeah, and let me ask Carol, if you have anything else to say. We have a video on that, I think. Unfortunately, it's not your video. I really want your video. We're going to get that later. But Carol, what, is there anything else you'd like to add to this discussion before I go to the audience?
Yes, Claire, from a NSO perspective, the issue, as was mentioned, the issue of data literacy. When we think of data literacy, we actually are thinking, how do we get persons to understand the data that we are putting out? But I think what this has shown is that it has to be the other way around. And I think Neil mentioned it. We have to find ways of making what data we have as simple as possible. So rather than trying to teach persons to understand our technical jargon and the issue for us on data literacy is maybe turning it on ourselves, and we now try and make it simple and take people just want the bite or the important point and to push that out so persons can understand quickly what's happening.
Absolutely. And we do have a video, I think, from Kenya, which is all about, you know, how do we get policymakers to use data, especially when they've got too much. So if we have that video, perhaps we can just play it before we go to the audience.
After the global outbreak of COVID-19, a country of 165 million people, Bangladesh,
COVID-19 exposed an urgent need for data to inform policy responses in Kenya. But while data was available, there was a need for an improved data ecosystem to create a seamless flow between data and decision-making. FSD responded to this need, bringing together a multidisciplinary team with skills in economics, data management, and social anthropology. Together with key data providers, we created a digital home, freeing data sets from PDF prisons and making a wide range of gender and location disaggregated data available for analysis. Over 40 data sets are now hosted on the COVID-19 Econ Data website. Working with government and research partners, we used rapid phone surveys and COVID diaries to provide demand-side information, filling an important data gap. Insights from the data were communicated using carefully curated packages, drawing on a wide range of data sources to provide new perspectives on the situation, with a focus on low-income, vulnerable, and marginalized households. These were compiled and shared in a way that met the needs of different audiences, through policy briefs, social media, and high-level policy forums. Despite challenges of coordination, funding, competing interests and priorities, the systems we have put in place are contributing to making data more accessible and impactful for policy decision-making, as well as keeping a focus on the low-income economy for an inclusive response to COVID-19 and to future challenges.
There we are, a little video break before we take some questions. And I've got some questions from the virtual audience. This might be a question for you, Manja. If I'm directing it at the wrong person, just tell me. It said, did you have individual citizens or non-governmental organizations take the data that you have and present it to the public in new and innovative ways?
We had individual citizens. It wasn't NGO. It was individual citizens taking the data. and we presented it to the audience using the community. So again, one of the things we realize is when you go into a lot of these informal settlements, a lot of people go there for all kinds of information, but they never feed back. There's never a return to say, I collected this data and these are the results and this is how it's going to impact your life. So we were able to feed back again because we have these structures that are embedded within the communities. So I think that's what we really did different this time. We really realized the value of the community structures and worked to strengthen them so that they'll be able to be in the communities and be able to give out information as and when they came out.
What we did was do vox pops. We went out just this year and asked Ugandans what do they know about, think about, vaccine hesitancy, etc. And so, and then in a television program live, we did 7 of them with the government of Uganda. We would play these vox pops and then show some data that either confirmed or contradicted what they were feeling. And then government officials were there and others to engage in a conversation about that. So we tried to close that data loop. We had extracted the data from them. We got their feedback from where they sit, how they're experiencing COVID, and then we had people then speak to exactly those confusions or concerns that Ugandans were having.
No, great, very innovative. I don't know, Carol, whether you've got any response to what they did in Uganda with the official data, which they used either to reinforce the message or to counter it. Is there anything being going on in Jamaica which is innovative, which takes your data and then in a very innovative way uses it for the public?
Usually it's the media that takes it when they're having special programs on COVID and use it to show certain aspects of it. But that is as far as I think it's done.
Mm-hmm. Have you noticed anything?
We would,
sorry.
yeah, sorry, we wouldn't go, persons, I think there's still a fear of COVID, so persons don't tend to go into communities unless they have to.
Understood.
Sure. I mean, there have been loads of really great initiatives, and maybe one illustrative one, which everybody's going to be familiar with, is the Johns Hopkins dashboard for COVID cases, which I think is a wonderful initiative. It's an academic group. It's not a government. It's not a it's an official statistics group, but they created a global surveillance platform and dashboard to report cases, and I thought that was really a very interesting initiative. And there have been many others, and also quite exciting for me, coming from a public health sector, is that people from other sectors have been involved, from physics and other quantitative sciences have taken data and used it in interesting ways and applied different approaches. So I think there's been plenty at the kind of higher level.
The New York Times has great data that they use.
Yeah.
Really, yeah, great maps. In Neil, Seattle, anything that you've seen out there which is really innovative and gets these messages out to the public, either from taking official data sources or from citizen-generated data sources, wherever the sources come from? What have you seen that's really been innovative?
I think what we've seen several iterations of the similar kind of hand drawing that was on the video that you played, that simplified various stories about COVID data. We've also seen the use of sort of cartoon ads, and again, just I think everybody on the panel really shared some great innovative ideas, but it really gets down to that tailored message. And it's the format, it's the story, it's the storyteller, all those things come into play. And I think the other panelists offered really great examples of what that looks like.
There's a question here, Carol. I don't know whether it applies to your context, but it's from someone in Switzerland who says, how can the statistical authorities retain public trust in official statistics in the face of public abuse of statistics?
This issue is not just since COVID. It has always been an area that statistics agencies we have to deal with. And I think one of the areas is transparency and communication. Transparent about what you do, how you do it, and communicating to the public in ways that we have been discussing, how we do things, ensuring that you are independent from government influence. And that is what, it's a part of being a statistics agency that you have to work with.
Excellent. I would like to ask people in the room to raise their hand, and a microphone will go round. Thank you very much. You caught my eye immediately. There's a lady over here. Say who you are. If you've got a question, who's it for? If you've got a comment, just let us know it's a comment.
Thank you, Claire. My name is Ninna from the Internet, the World Wide Web Foundation. I'm coming back to communications again. That's my agenda for this meeting. First a comment, then a question to all three. I live in Abidjan in West Africa. It's in Côte d'Ivoire. And what we did was actually we ganged up as citizens, because this time around, COVID was not a statistics issue, it was a citizen health issue. We looked around, we held a survey, we found the most trusted voice, which was that of the Abidjan Préfet. It's prefect in English. And we went to him, we said, "Good morning, sir. We trust you. We want you to speak to the statistics." He said, "Okay, what do you want me to do?" And we did videos, like Aiden said. But then here's my question. When we did the video with the prefect himself, and then we sent it first to social media, secondly, to radio stations, especially local radio stations. And thirdly, we interpreted some messages into local languages. After that, we removed the voice part of the video and then sent the voice part as voice notes on WhatsApp, because that's what many Africans use. It's very easy. And so my question is, apart from social media and traditional media and influencers and trusted voices, what other information intermediaries or intermediaries have we used? I know we use pastors, imams, village heads, comedians, and all of that. The reason I'm asking is, it's not just pandemics, it's not just the health pandemic now. We have a lot of depression, we have a lot of other statistics coming out from COVID. Because if we get a clear idea of which other intermediaries are available to statisticians, we can employ them in other life events. So my question is on intermediaries that statisticians can use while they are learning to communicate better. Thank you.
Yeah, I think that's really interesting, these infomediaries, yes, because there's always the idea is if you get an influencer or an ambassador, they're going to be more credible, perhaps.
Health workers, Nena.
Health workers, yes.
Health workers. But they too need to be, by the way, convinced of the message that they're supposed to.
And they're not always vaccinated.
And they're not always convinced, so they're not always vaccinated, yeah. So that's a group of people you need to keep close.
Yeah, you know, and I have to see what this video is that the Swiss hospital is making. But if you've got a nurse that says, this is the toll on my family, you know, this is what it's done to me, you know. I was moderating a panel with the head of the Swiss hospital, HUG, and he said, you know, people just don't understand the psychological impact on my staff of this. And it's not only dealing with these people who are very, very ill, but the amount of verbal abuse, even in Switzerland, that the staff are getting, you know, either because of the regulations that you can't visit or because of, you know, the anti-vaxxers is just immense. And we need to hear that, I would say.
I would also say we had messages as well. One of the innovative things we did was we teamed up with the Motor Drivers Union. So in public transportation, these are the public transportation, but they're privately owned. So we have boda bodas, we have motorbikes, we have tricycles, and we worked with them to have these jingles played in their vehicles, especially during rush hours. So in the morning, when they were transporting young kids to school, and then in the evening when parents were going home and workers were going home after work. And that was very successful. So that was one medium that we used.
Yeah, you've got a big comms department. What are they doing, Oliver?
I mean, I think the other speakers have covered the communications at the community level and the national level. I think there are other, let's say, channels that we've been exploring, and for example, through kind of corporate communication channels. So there are some very large companies around the world. Airlines is a good example, but there are many other multinational companies who have very large workforces, and they communicate to their staff about the health issues. And there's also clearly the education sector, which is extremely important, especially for messages for children at school, for example. So I think there are other channels in addition to the ones that others have mentioned here.
I mean, and that's interesting. I'm just thinking, Neil, you're a foundation, and these big companies often, they want to make their workforce feel better about what they do. So there's a certain internal communications, what can you do yourself, or what contribution have you made, to combat COVID or whatever. So I just threw as a foundation, there's some internal communication exercises for staff at Tableau, perhaps, things that they can do.
Yeah, we actually, Salesforce, Tableau is owned by Salesforce now. Salesforce had a Get One, Give One campaign. So if a person got a vaccine, then they would donate a vaccine, and that was very effective for people. And then there were lots of volunteer opportunities. We sent volunteers for a pretty extensive engagement with a large UN agency to help them wrangle their COVID data and get it useful for themselves. And so between volunteering, the Get One, Give One campaign, it was a lot, kind of all hands on deck, trying to be very creative. And then, of course, with all the offices shutting down and now trying to come back to life, just careful communications about, who should be vaccinated and what happens if you're not vaccinated. It's a very delicate dance with a wide, global, diverse workforce.
That's really interesting, this get one, give them, get one, give one, because I think that's what the Swiss are trying to do at the moment. It's still not been agreed, but this idea that you'll get 50 Swiss francs, that's about what, $50 US. If I encourage Olivia, who's not been vaccinated, to get vaccinated, I get $50 US. I think that's the idea. And there's a big polemic at the moment going on in Switzerland about. But yeah, it's really interesting how innovative you have to be in a crisis. Yeah. So thank you. Really good question. Let me ask the gentleman here, and then there was a lady there, and then there's a gentleman there. So please. Yes, the microphone to the gentleman in the front row, then the gentleman, the lady over there, and then the gentleman there.
I am Omar Saeed from Pakistan. I am Director of Finance in the top-ranked 100 universities of the world, Agriculture University, Pakistan, Faisalabad. My question is about the data collection and in third world countries, there is always a finance issue. So the world organizations or the NGOs should support the third world countries in gathering the data about the pandemic and other things. So they will be very much able to analyze it and make it for future vision. Thank you.
Is that a question for you, Oliver?
I mean, I think I think almost in every country we would say, there's not enough investment in this area, whether it's, in the formal, let's say, the government sector, or whether it's in, community groups or other types. I think there's obviously not a straightforward answer to this, but unless we do recognize the importance of investing in this, other efforts that we make to either improve the types of data that we have, if the capacity to use those data are limited, then we're obviously not making a good investment in that sense. And I think in the broader issue of data governance, the ability to kind of interact and use the data for various different parts of your society is critically important. So I agree with you, we have to look at this in a much larger issue, and that's part of the public policy dialogue.
So there's a lady over there, and then there's a gentleman with a cream shirt here. And then we'll go over here.
Hi, my name's Teresa from Angola. My question is regarding communication. We spoke about people being skeptical, and I think Carol spoke about social media being important. At the beginning of the pandemic, people were quite skeptical. For example, Idris Elba had COVID, Boris Johnson had COVID, and people would be like, oh, maybe they're just lying so that we believe that COVID exists. Manja said that WhatsApp is quite big in Sierra Leone. It's big in Angola as well. I had COVID myself, and people were skeptical in Angola, and they started to believe, well, people close to me started to believe it when I sent pictures of myself, you know, under oxygen in hospital. I was in hospital for 3 weeks, and I think it spread, and people started to believe it more. But I think there was still a lack of actual information about COVID, specific information about COVID. And Manja mentioned that you would go to the markets and you go to people with information, and you'd gather the information and then bring back the results to them. And the question would probably go to Aidan as well. Did you set up like a station or a phone number or something where people could call up, where one person could call up and ask for specific information, because the average citizen would be confused in general? Like Claire was saying, you don't know which mask is the right mask, you don't know how you can get contaminated. It was very confusing at the beginning. Is there a way that the people could come to you if you don't go to them with the information?
Yeah, sort of hotline. Yeah,
I think governments set up hotlines. I know the government of Tanzania set up hotline. There is a fine balance here, because, you know, if you allow, you know, Aidan to tell you about COVID, he could really misinform you very, very, very seriously. So governments try to do that. What I think civil society tries to do is reflect back to government how people are actually experiencing it in ways that maybe government is unable to ask. Number one. Number two is help government communicate better what they need to communicate, because governments can also, you know, in a bid to be accurate, they won't go to comedians maybe, or they won't go to others who have a certain credibility in the community. So civil society organizations can help send that message out further. But the third thing is, I mean, your example is a good one. Because you sent out pictures of yourself under those conditions, reduced the uncertainty of others around you who know you, who say, actually, she would never pretend, this must be serious. So it's a little bit dramatic, unfortunately, but you're right. Many people just don't believe it until they themselves have seen somebody, lost somebody, or have actually experienced it. Now, how do you do that many, many, many times over? Perhaps that's the lesson of this pandemic. You know, human beings want to experience something at first hand before they make a decision. Gosh, what a way nature teaches us to learn. You know, it's a tough one.
Yes, Manja, a hotline, was that something that was in your...
Yes, the national government set up a hotline. We realized very fast that the hotline was bogged down with questions that really were more community engagement questions than emergency questions. And so we had a COVID hour that we had on television, and what that did is the information that we got from communities in terms of the myths, what they felt about COVID. So in addition to having the community structures, during COVID hour, we would make sure that we actually go into those questions in detail and try to inform the public on issues that were coming from communities.
Yeah, great. Lots of ideas there. Let me ask this gentleman, and then I'll come over, of course, to this side of the room.
Boris Engelson, journalist freelance from Geneva, and I am not a gentleman, as I will soon prove.
Okay.
So,
you've got my attention.
It has been told over and over again that the most precarious are more prone to be casualties of COVID. It is a nice sounding sentence, but nice sounding sentences are rarely true they most often than not are what we call in French fausse évidence. Common sense would say that, for instance, poor farmers out in the field are less likely to get COVID than spoiled children in a dancing hall. Mm-hmm. So do we have figures, evidence, able to test all these different assumptions?
Who would like to pick up that question?
That's a WHO question.
That's a WHO question,
sure,
don't you think?
Yeah, I mean, I can certainly point to you, maybe let's talk after this meeting. I think there's plenty of information now around secondary attack rates, if you want to use the epidemiologic term, about different people in different occupations, in different settings, in different age groups. So I could certainly share that with you. But yes, that's information that's being gathered from around the world in various different countries, in various different settings.
So we've got 7 minutes by my watch. Let's go and see who else would like to ask a question. There's one right in front of me, a lady I recognize from her great speech during the opening ceremony, Alicia, the UN Youth Delegate.
Thank you, Claire. Hello, I am Alicia, UN Youth Delegate from Peru, and also I am a medical doctor, and I'm very impressed about all these panelists. Really great insights. So first I have a comment and then a question. So I was very impressed about all the mechanisms that Manja said in Sierra Leone. I'm sure that if these mechanisms were applied in my country, we could have done much more better, because it's a more like people-centered approach to the pandemic, and to make them, to make like evidence more clear to the people. And also I wanted to ask now about the information bubbles. So for example, I need just some clicks to go to the other information bubble that is not like my common information bubble, right? So people that, for example, do not believe in vaccines, I just need to go to do some clicks and then be in that environment where all of this is discussed. So has there been any approach or any like mechanism where we can get into this other bubbles that are very like far away from what we think usually, and can we deliver these clear messages, simpler messages about evidence on COVID or on any like global health problem to these peoples? What would be your answer? And it's for all the panelists.
Okay, and I'll have to ask them to be concise, because I'm getting big flashing letters, because I thought this ended at 12, and it apparently ended at 11:45. So it's just as well I no longer work with the BBC, because I'd have been sacked. But, so I'm sorry, we're being told in big flashing letters to wrap up here. But if anybody would like to take Alicia's question. Aidan.
Let me attempt. COVID, climate change, deeply complex scientific issues, which make many mere mortals like myself just shut my eyes and ears and say, I'm just going to live in my little information bubble. You put it very nicely. So the onus really is on us who are able to understand maybe somewhat more this complexity, to help our own loved ones understand it as well. We need to make it real in their own lives. Paint a picture for them of a world in which certain actions lead to certain conclusions, and also to validate what they've done. You know, in Tanzania, for example, we tell people, look, why are you hesitant about the COVID vaccine when your children have had the DPT and the whole alphabet soup of vaccinations when they're young, they're babies? This is just no different. So, oh, okay, that makes a little bit more sense. So if we can connect it to their own lived reality, you have a better chance of communicating what you need to do.
Yes. Let me ask Carol to have her final say on how do we counter this misinformation, people in their own bubble. Very briefly, then Neil, then Manja, then Olivia, and then it's a wrap.
Are you hearing me, Claire?
Yes, we're here.
Okay. Oh, we're having heavy showers in Jamaica, so I wasn't sure if you were hearing me. Well, the issue of, I couldn't hear the questions very well. The issue of misinformation, It's not new to a statistics agency, and as I said before, the issue is to make the information as simple as possible and be out there as possible. Make it easy for persons to get access to this information. I think this is just a process, and it's a process that we will have to continue on as national statistics agencies.
Thank you. Neil?
I think the theme that I picked up from today's conversation is that this is really, at the end of the day, all about people. And we just have to find ways to connect the data to the people and to tell them stories from the data that make sense to them and resonate with them.
Yeah. Manja?
So different countries, different communities have different circumstances and COVID has impacted them differently. In Freetown, we're the highest, we're the city with the highest number, and we have less than 3,000 cases over the last 18 months. So the way it's dire in other parts of the world, we haven't seen that. Our deaths are under 200. We haven't seen the kind of impact other countries have seen. So the message that's being given, this fear-mongering, doesn't work for us because we haven't seen it. So I think we need to really approach it with empathy and data and really continuous engagement to get our citizens, our residents, to agree to take the vaccine.
Olivia?
I think it's a great question, and there's not an easy answer. At least I don't have a clear answer to that. I think it has to start with recognizing that we all live in our certain types of bubbles, whether it's an information and news bubble or a data bubble or a cultural bubble or a language bubble and so on and so forth. And it's being kind of curious about stepping out, at least to understand other points of view. And I think that sounds a bit simplistic, but I think that's where it needs to start.
Okay. So we've been talking about videos. There are 2 videos. Videos are a good way because they appeal to our senses. We await for the video from Uganda. That's a promise.
I promise.
There we are. But there are 2 other videos that the UN would like to show us now. But before they play them, let me just thank you for your questions. Sorry we couldn't take so many. I think we spent 40 minutes at least on questions, which is great. I'd like to thank really Carol for getting up at 4 o'clock in the morning beyond the call of duty. Neil, similarly. And thank you also, Manja, for coming from Freetown, Sierra Leone. I know it wasn't so easy. Also, thank you for coming from Tanzania. Thank you for coming from Geneva.
After the global outbreak of COVID-19, a country of 165 million people, Bangladesh, faced its worst crisis in the 21st century. Despite the valiant effort from the healthcare workers, lack of robust infectious disease surveillance and control system drove Bangladesh towards a situation of not knowing where the disease was spreading faster and where to prioritize interventions. With the technical assistance from A2I, massive data collection mechanism was formed, helping in analyzing the scenario of the country and effectively guiding the policymakers to take near real-time decisions. COVID-19 National Dashboard was born. To make this possible, A2I started by collaborating with Directorate General of Health Services under the Ministry of Health and Family Welfare and repurposing the National Information Hotline 333 as the largest telemedicine service in the country. These allowed the initiative to collect massive information regarding citizens' COVID-19 related reports and also to provide initial health advisories. Further along, into the COVID-19 National Dashboard, A2I also integrated the data collected from the telecom service providers, various websites and mobile applications from the community health workers and RT-PCR labs across the country. The COVID-19 National Dashboard is now capable of predicting any major outbreak or spread into any area 7 to 10 days in advance and generate policy recommendations for the administration. Its simplistic visualization of the analysis also helped take the decisions about imposing effective early interventions. COVID-19 National Dashboard has become an effective weapon in the fight against this deadly disease for Bangladesh and can be a triumphant example for the developing countries across the world.
This story map was developed by the National Institute of Statistics and Geography of Mexico to show the role of geospatial approach to reduce the data gap and facilitate the communication on the 2030 Agenda measurement methods. Women devote a significant portion of their time to caring for other people, as part of generally unpaid, unqualified, and unrecognized work. Their great participation in the paid labor force benefits their living conditions and the entire community. Is the proximity of different services, in particular care, a dimension that facilitates the integration of women into the workforce? To answer this question, the first challenge was to make a classification of services according to the support they provide to women. This led us to experiment with natural language processing models to classify the National Statistical Directory of Economic Units, detect the services, purposes, and target population, and create a replicable system for other databases. We can see how these services are distributed, the inequality of access to intermediate services in urban areas, the disaggregation of urban areas access depending of the type and range of services. We observe a positive correlation between the participation of women in the workforce and proximity to service, and between the lack of proximity and indicators of marginality, a low level of housing services and goods, the lowest average level of education, etc. The following maps compare the participation of women in the labor force and some characteristics of communities with or without access to services. This work will continue through a continuous improvement of the machine learning model for replicability, a definition of geospatial indicators to observe territorial conditions, the systematization of analysis in a dynamic platform to monitor over time and inform local policy. Thank you very much.
Very, very much for your attention. And Aidan's going to say where you can find his video. Aidan, tell them.
Okay. YouTube, go to YouTube and plug in the words Yambala mask, all one word. Yambala mask. And if there's one Ugandan word you must remember, it is to yambala your mask as you're going out for lunch.
Thank you very much. Great.